Probably 1 in 3 Americans, or 70 million people, has hypertension, and up to 50% of those patients are either not treated or undertreated. 1 in 5 may not even know they have the diagnosis. I'm Dr. Jake Hochrein. I'm a cardiologist. I'm the chief of the Cone Health Cardiovascular Service Line and Cone Health Medical Group HeartCare. Hypertension really is known as the silent killer, and it's because it doesn't cause a lot of symptoms. You really have to get a blood pressure check. The nice thing about that is getting a blood pressure check and getting screened for hypertension is probably one of the easiest things we do. I mean, you can get a blood pressure checked at any primary care office, at any appointment with just about any provider, at the community health fair. So what is a normal blood pressure? Well, typically we treat people for hypertension when the blood pressure is 140/90. Although it's a little bit different, what we consider normal, based on your age and based on whether you have other conditions such as diabetes. We would begin to treat blood pressure at that level, 140/90, typically. What is normal might be more like 120/80. And in between is what we call prehypertension, where we begin to pay attention to the risk factors. Patients don't know that they have hypertension because, one, they may not see a doctor, or two, they may have been told they had high blood pressure at some point in time, but they really didn't pay much attention to it. We see those patients later on when they present with some of the problems that occur with untreated hypertension. We'd like to get to them long before that point. The problems they present with might be heart failure, kidney failure, or even strokes. And all of that is potentially treatable, preventable if they get diagnosis and treatment early. So the question is, how can we prevent or treat hypertension? At times, your physician may diagnose you with hypertension, and you may need medical management from the beginning. But in all situations, your provider should also be suggesting therapeutic lifestyle changes, or what I like to call TLC. I think the bottom line is that we need to reduce our salt intake, we need to reduce our sugar intake, we should be going for more complex carbohydrates, and for trying to avoid the foods that turn quickly into sugars. And I often tell people that's the white breads and the white rices and the white potatoes. And what's really, really important about weight loss and hypertension is that it doesn't take a lot, that we can see reduction in blood pressure from 5 to 10 pounds. And sometimes the reward for losing weight is you actually get to come down or even off of your medications. We should limit our alcohol intake. There's great discussion about the potential merits of something like red wine. The bottom line is that too much daily alcohol consumption is unhealthy for a number of reasons, and one of those is it can lead to difficult to control hypertension. It is a problem. It is a difficult addiction for a lot of people, and it is something that people should concentrate on and try to find help. Talk with your doctor about the best methods, the best resources for stopping smoking. Another therapeutic lifestyle change that's important and that's recommended for blood pressure control is to increase your activity level. And that's critical for so many different health problems. We don't exercise enough as a country. It's estimated that only about or less than 25% of adults get the recommended amount of physical exercise on a weekly basis. We should get about 150 minutes a week of a moderate level of exercise. And a moderate level of exercise is something that makes you a little flushed or a little short of breath, but not something that is so physically exerting that A, you're not enjoying it, or B, you can't do it the next day. For instance, I tell patients if you're walking with somebody, you should be walking at a brisk enough pace that you wouldn't have enough breath to sing, but you would be able to carry on a conversation. This is Dr. Jake Hochrein. Thank you for letting me join you today. I hope this information was helpful. Cone Health is committed to your wellness. For more information, please go to conehealth.com/heart.